the states need to recognize that we have community leaders as well as professionals. And if you look at addictions and you look at prevention, treatment, or intervention and treatment, their indicators are all shared. Indicators of risk are shared with multiple health issues. And I think that we need to look to what we have. I liked, Sis, what you had to say was the fact that you're short-staffed cannot be an excuse. We need to band together. Our systems and need to come together and work together, and these silos of prevention, intervention, and treatment can no longer exist, because now we are going to expand into court systems and health systems and all others. So I think we start with what we have and we bring together and start to integrate our services is, I think, at least a good place to start.
Sis.
States are required to license people to do certain things in every field. And the prevention field is one of them, so is the treatment field. And in that process, I'm not sure that they always look to what would be, I would call, the volunteer component. The people who are the real preventionists in our communities are the teachers, the parents, the grandparents, the clergy, and the medical professionals. The prevention professionals can craft programs and can coordinate things and can provide some services. But if they aren't working in tandem with this high quality, on the ground volunteer component in our communities, I think we're going to really miss the boat. And ultimately, and I always say this about our organization, NACOA, I'd love to see us be able to go out of business because we weren't needed. And if everybody else were doing their job, we wouldn't be needed. And I think the way we fund programs, starting at the federal level but going through the states, needs a new look in this new era. It's not just about healthcare reform, and it's not just about coalitions. It's about those on-the-ground people understanding and being empowered. They have to be empowered.
Now, Sean, Sis mentioned a little bit ago in the other panel that there are many welfare workers who are not trained in addiction treatment. There are many people that will be pulled together within this new healthcare reform that may not be fully versed in addiction treatment. What would you say to someone in that capacity right now if they felt that a person that they were taking care of had an addiction?
Well, I think, and here's the problem with the high turnover. If a caseworker lasts 5 years, they do get that training. I mean, you work with it long enough, you interact with the providers, you do get more informed in knowing what to do. Our problem is with the new caseworkers or the new people who in doing this work. And one of it comes into giving them the support to not be overwhelmed by what they're encountering with the family. Because I mean, a lot of them are just not emotionally ready to deal with what they encounter and to deal with, you know, they come in thinking they're going to save the family, and then the family kind of throws things back at them and doesn't like what they're trying to do, and it becomes difficult for them. I think bringing in the people who have that knowledge is in a partnership sort of way, not as, you know, someone who's going to tell you what you need to do, but someone who's working with you as a partner to work with this family, gives them the confidence that they need to not feel overwhelmed by the experience. And if they can stay in the system long enough, they will become experts. It's getting them there that's the challenge.
One final thought. If you were talking, and we're going to go around the table, if you were talking to the people that are writing this new healthcare reform, and you were concerned that they may not fully address the issue of prevention, addiction treatment, or behavioral health, what would you tell them? And I'm going to start with Sis.
I would tell them that if you don't ask questions of family members, including children, when they come through the system, questions such as, is there anyone in your family using alcohol or drugs that you're worried about? If you don't ask the questions, that information will not surface, and no matter what other health service you provide, you will have missed the main event that's being destructive in that person's life.
So make sure that the screening systems are in place in order to tease it out.
But we only screen potential use on the part of an adult client. That's what the whole screening, brief intervention, and referral, and that's excellent, and it's had wonderful results. But we've forgot to screen the larger percentage of people from that family who are in great pain in most cases.
Nakshan?
I would say that it's just a question of cost effectiveness more than anything else. If you're wanting to bring down the cost of healthcare, you got to start addressing what are the underlying causes of an unhealthy lifestyle that creates huge medical concerns. And so if we don't allow there to be any funding for either substance abuse treatment or I would put in there mental health services, you're going to be spinning your wheels. I mean, those are the things that lead to chronic health problems like liver problems and other sort of even things that go along with bad health, eating and dental work and things like that. You're going to have a group of people who just need very high level chronic medical care. And so you got to address this so that you can bring those costs down.
Donera?
I would say ask and educate, and just that, you know, it affects more than one person. It affects, you know, the whole nation, you know, so just ask and educate. That would be my advice.
Fran, you have the last word.
Oh, I would say that as with other chronic health diseases, we need prevention if we're ever going to break the cycle and change our communities, families, and schools to become healthy and safe. And we need every member of the community and our professions working together to make that change happen.
And we all know that September is National Alcohol and Drug Addiction Recovery Month. We want to encourage you to go on our website at www.recoverymonth.gov and look at the wonderful materials that we have prepared for you and for your organization in order for you to do events, activities during September. But September is not the only month that Recovery Month exists. We have wonderful opportunities to get information and find out what our planning partners are up to, and there's a lot of them. So we hope that you go on the website. We hope that you celebrate those that have gone through their hardest battle that anyone is ever going to go through, which is their road to recovery, and help them sustain their recovery. Thank you for watching.
Every September, National Alcohol and Drug Addiction Recovery Month provides an opportunity for communities like yours to raise awareness of alcohol and drug use disorders and highlight the effectiveness of treatment. 2009 will mark the 20th anniversary of this annual celebration of addiction treatment and recovery. In order to help your organization plan events and activities in commemoration of this year's Recovery Month observance, the free Recovery Month Kit offers ideas, materials, and tools for planning, organizing, and realizing an event or outreach campaign that matches your goals and resources. To obtain your copy of this year's Recovery Month Kit and gain access to other free publications and materials related to addiction treatment and recovery issues, visit the Recovery Month website at www.recoverymonth.gov or call 1-800-662-HELP. It's important that everyone become involved because addiction is our nation's #1 health problem, and treatment is our best tool to address it. For a copy of this program or other programs in the Road to Recovery series, call SAMHSA at 1-800-662-HELP or order online at recoverymonth.gov and click Multimedia.